So first we're going to talk about what is affordable care. So on March 23rd, 2010, President Obama signed the Patient Protection and Affordable Care Act into law. And the goal of this law was to increase healthcare coverage, to reduce healthcare costs, and improve affordability, as well as improve people's health. So some of the changes that did occur based on the Affordable Care Act was that everybody was guaranteed coverage. Now, before, a lot of insurances used to either deny coverage or charge more premium with the cost for the consumer. And through the Affordable Act, any pre-existing conditions now just against you to either deny you or give you any limits as of your coverage. And the rates are not based on your health status. The price and also large employers also now have to offer coverage to their employees. I don't know, some of you have heard people say because of Obamacare or the Affordable Care Act, I lost my health insurance, or because of the Affordable Care Act, I no longer have insurance and I have to work. These are something that a lot of people I think that because of the Affordable Care Act, they no longer have insurance. But what happened was that a lot of the insurance were not meeting the essential health benefits that the law says that all insurance companies need to be able to afford to their consumers. Or some of them had only certain amount of money that a consumer is able to use, and then after that, insurance wouldn't cover any of it. And now through the Affordable Care Act, regardless if you get a public or private insurance plan, the essential health benefits are the same, and there are no limits as to how much the insurance is able to provide for you. Okay, so now we're going to talk about who's eligible for Cover California. So in order to be eligible for Cover California, you do need to be a legal California resident. People that are undocumented, unfortunately, are not able to enroll for Cover California or other people that are incarcerated. So now we're going to talk about how the exchange impacted us. The one thing it was through the Medicare. The Medicare plan, before there were certain restrictions that didn't allow Black people to qualify for Medicare. And one of them was you needed to have a disability, you needed to be pregnant, or have a child under the age of 18. Now, Medicare was expanded, and an individual that is not pregnant, that doesn't have a disability, or doesn't have any children, qualifies for Medicare. And Medicare is free or low cost. Now, the other program that we're familiar with is Cover California. And Cover California is just a database. You can see it at a shopping mall or a marketplace. And you can actually go on the website, put on some basic information, and you can shop around for the coverage and the healthcare plan that you feel is best for you and your family. Now, as I mentioned, the two essential health benefits. So these are the benefits that the government says that regardless of what insurance is being offered to you, you all have to provide all these benefits, like ambulatory physician services, emergency services, hospitalization, maternity and newborn care, mental health and substance use disorder services, prescription drugs, rehabilitation and rehabilitative services, laboratory services, preventative and wellness services, as well as pediatric services. Like I mentioned, the first option that people have here in California is Medicaid. So for Californians with limited income, Medicaid is a public health insurance program that provides coverage to very low or no cost. And I also have more information in the following slides that actually have the increments of how much one person can make to qualify for Medicaid, and family 2, family 3, and so on. And California was the first state to expand their Medicaid using government funding. And the last point is that the eligibility for the new expanded Medicaid is based on income and family size only, like I mentioned. It doesn't matter if you have children, if you have a disability, Nothing else matters anymore. Doesn't matter. Also, before we did have the asset test. So if you qualify for Medicare, they want you to know your own property, your own houses, your own cars. If you did, they would actually take the values of your property and add it into your income, which then you can qualify for Medicare. Based on the expansion, that the asset test is no longer used. The only thing that is used is your current income, which is your earned income or any other sort of income that you're receiving, like Social Security or retirement or pension. Everything else, any old property is not being considered for income. And now this is, I think, the more popular one. So in order to qualify for Medicare, you have to be at 130% of the federal poverty line. And I feel like there's a lot of people that qualify for Medicare, for Covered California, and now we're going to talk a little more about it. So like I mentioned, Covered California is like the marketplace for people to shop for affordable health insurance coverage. And then Covered California will allow people to make comparisons of what health plans are offered to you, and a breakdown of how much you will pay for your premium assistance, how much assistance you get from the government, as well as the benefits that you'll receive from the healthcare provider. But only citizens and lawfully present individuals are able to buy coverage through Covered California. And here's the stability chart that we show most consumers. Number of people in your household is how you file your taxes. So you file on your own and you still live at home. Although you live with your parents, if you file C1 on your own, you're still only considered a household of one. So household really reflects how you file your taxes. As you can see here, an individual that would make anywhere from no income to $16,105 will be eligible for Medicare. If he's either a citizen or a resident or lawfully in the United States. Now, if that same individual or different individual made more than the $60,105, as you can see on the right on the second slide here, it would be Covered California with premium assistance. So anywhere from the $60,106 to the $46,680, you would qualify for premium assistance. Premium assistance is a subsidy that the government is going to be paying whichever healthcare provider that you choose monthly, and you will only be responsible in paying the difference. So let's say, for example, this one individual decided to go with a certain healthcare plan, and his insurance was $200. Now let's say the government assisted him with $100. So this $100 the government would pay every month to the insurance company, and that individual would only be responsible for paying the difference, which would be $100. And it varies. The premium assistance varies depending on your income. So the farther away you get from the $60,106, meaning the more income you make, the less premium assistance you will receive from the government. Now, the more income that you receive, the less premium assistance you receive. So everyone, it's very different. Everyone will receive different premium assistance. Not everyone will get the same. It all depends on the income in the household. As you can see, the more people you have in your household, the more income you're able to still make and qualify for Medicare or premium assistance. Family of five can make up to $38,560 and they all get Medicare. Or they can even make up to $111,640 and still receive some sort of premium assistance. And now we're going to talk about some of the tiers of levels of health insurance that you're able to select on Covered California. Now, this is only for Covered California. For Medicare, is very different. You turn in an application, you become eligible. Once you're eligible, there are HMO plans. There are only HMO plans. After that, you just select which plan you like. And you don't have to pay premium assistance, you don't have deductibles, you don't have out-of-pocket limits or anything of that sort. This is only for Covered California. So if you fall under for one individual over the $16,000. And the 4 tiers are bronze, silver, gold, and platinum. Now, although there's 4 tiers that you get to choose from, remember that they all have the same essential health benefits. Bronze, silver, gold, and regardless of which one you choose, they all have the same benefits. Where they differ is when we're talking about the annual deductibles, your premium payments, and how much your insurance can cover up front. For example, if you look into the bronze, which is the lowest metal in the tier, you can see that it has the highest deductible of $5,000. You can also see that the plan is only going to pay 60%, and you will be responsible for 40% of your health services. And as we move up from silver to gold to platinum, you can see that platinum and gold, they have no deductibles. And the insurance pays 80 to 90% of all your medical expenses. And you're only responsible from 20 to 10. So it just depends what your health needs, what plan, whether you can pay high premium upfront every month, and how much you will be visiting a doctor. It all really comes down to that. Okay, and now when you're in exchange and you're purchasing a healthcare plan, it's very important to know these terms. That way you can make a smart and the best decision for yourself. So let's go over these terms. So the premium. The premium is how much you will be paying every month just to be a member of that specific insurance. Kind of like Costco, right? Whether you go to Costco or not, you still have to have a membership to get in. So that's what the premium is. It's just being a part of that group, being covered. Okay, now this premium assistance, that's a good part. That's what you want. You want to be able to have some kind of subsidy assistance from the government because it will make your premium lower. Some people might qualify for large amounts of premium assistance, and other people, unfortunately, might not qualify for any. So, like I said, it varies for everyone, and every individual is a different specific case. Now, the deductible. The deductible is what you're going to pay out of pocket. So, after you pay your premium, next comes the deductible. And everyone's deductible, depending on the metal you choose, is different. If you're going over from $500 to $5,000. So, let's say something happens when you go to the hospital. You have to know your deductibles because that's what you have to pay out of pocket before the insurance company helps you with any assistance financially. Now, your copay. Your copayment is what you would pay anytime you're going to see your primary care doctor or consultation or anything of that sort. You even have copays for medication, where you pay once and then the insurance pays the rest. So you're looking at $20, $40, $60, just depending on the plan you select. Your co-insurance is a percentage that the insurance says that you're responsible for paying after you leave your deductible. So let's say, for instance, your premium assistance is $20. So you pay your $20 every month, and then something bad happens, you get hit by a car, you end up in a hospital. This is a deductible of $500. So you would first have to pay $500, and then you would pay still your co-insurance, which is a percentage after whatever's left over after you pay the deductible. So let's say it was $2,000, you pay your $500 for your deductible, $1,500, and let's say your co-insurance is 10%. So then you're responsible for that 10%. Out of pocket, the insurance will be responsible for paying the rest. Now the last term, and I feel like it's the most important term, is your out-of-pocket limit. So your out-of-pocket limit is the amount of money that you will pay in the entire year. So let's say the total could be $2,500 or even $5,000. So anytime that you go to the doctor, you do your copay, if you have a deductible, if you get medication, if you need a surgery, whatever the situation is, anything that you're actually paying out of pocket besides your premium, it's going towards that out-of-pocket limit. And once you reach that out-of-pocket limit, then you're not responsible for paying anything else for the rest of the year. And that's very important because some of us we can have surgery, a bill to the emergency room. It's really easy to wrap up, and you can do $50,000 in one visit, one surgery. And that's very important because if your out-of-pocket limit is only $5,000, that means that out of that humongous bill that could be up to $50,000, you're only responsible for paying the $5,000. Your insurance will pay the $45,000, and for the rest of the year, you're not responsible for paying anything out of pocket besides your premium payments. So, like I mentioned, all these terms are very important. You need to know exactly what they mean. That way, you can make a wise decision for yourself when purchasing insurance. And then here is a little more broken down example of different tiers of the medals. As you can see on the left, it has like the deductibles, your primary care visit copay, your medication copay, emergency copay, other expenses that you might have. And then it's broken into the four medals. Within the four medals, you can see the deductibles and how much you would pay out of pocket for any medical services. So like I mentioned, the bronze being the lowest medal has a high deductible of $5,000. And then silver is $2,000, and then gold and platinum, yeah, no deductible. And then your copay to see your primary care physician, it could go from 60 to 20, generic medication from 19 to 5, emergency room from 300 to 150. Now, what I try to tell my consumers and I try to explain is the fact that I think that the bronze, because you might think, okay, $5,000 is very high. Plus, you still have to pay the $60 and $19,300. That's a lot of money that you're going to be paying out of pocket. You still have your $6,350 out of pocket limit. So I usually say that the bronze is for people that want to satisfy the law, first of all. And second of all, they just want to prepare themselves for a tragedy. Because obviously the $6,350 is a lot better than a $15,000, $20,000 medical bill. So that's, some people that they feel like the bronze is a good fit for them because they hardly see the doctor, they're young, they're really healthy, and they know they only want it for an emergency if something severe happens to them in their health. Now the silver and the gold are very not a big difference besides the deductible. It just depends how regularly you are using the doctor and how much you use the services. And actually here we do have an enhanced silver as well. For the enhanced silver, it's a little different because you not only get subsidy assistance for your premium payments, but they also help you with your cost sharing expenses like co-pays and co-insurance. So the numbers from like 45 to 19 and 250, they do decrease. The platinum plan is for someone that they know they have a pre-existing condition, they know they're going to be going to the doctor often, they might have had cancer in the past, or have cancer, or they have HIV, or some kind of disease that they know that they're going to consistently be seeking medical services, and they want a plan that they know that it's going to cover them and it's going to be affordable to them.
People on the live stream, you're not facing, they can't perceive, everything's garbled. So if you don't mind facing the crowd a little more, I'm sorry to interrupt. Thank you so much.
Okay, so like I mentioned, if you have any pre-existing condition, they can give you a higher rate for your insurance. But there are other factors that insurance companies are able to take into consideration when quoting you for your premium, and that is age, your age, your zip code, so the area in which you live in, household number, like I mentioned, as well as your health plan and benefit level selected. So like I said, like the bronze, silver, gold plan, depending on which one you choose, they're obviously going to have different premium payments. And then another thing here that's mentioned is, so have you guys gone on the website? Has anyone actually gone on the website and filled out an application? Okay. So as you can tell, at the end, when it gets to the eligibility part, if you qualify for medical based on your income, you can continue forward. You're eligible for medical. So if you are eligible for medical based on income and you choose to deny medical, you say, I do not want to receive medical, unfortunately, if you deny medical, you're also denying any premium assistance. So if someone qualifies for medical and they refuse to get it, that means that they're looking into paying completely everything out of pocket. There's no premium assistance. Yes. So, okay. And then this is some basic information that you will need when putting on your application, which is proof of income. You're either going to need last year's taxes, 2013, or current check stubs. And the application is kind of simple because you get to put in the numbers. So you can approximate how much you think you're going to make or how much it's going to approximately be. And this is very important, I would say, to overestimate a little. You have to instead of underestimating. Because the way it works is once you file your taxes, Corporate California is going to know how much you report it. And let's say that the number that you reported on your taxes ends up higher than what you report on your current California application. The subsidy, if you receive subsidy, they're going to determine that you received too much subsidy that you didn't need, and they're going to ask you to pay it all back. And they're going to ask you to pay it all back at once. So let's say you received a subsidy for 6 months, and they realize that you underreported, so you receive more subsidy assistance, they're going to pay it all at once. And we know how the IRS is. We can't play with the IRS, so we have to make sure we do things right. Now let's see what happens if you overestimate. So if you overestimate, they're going to realize that you should have done more premium assistance, which you didn't, which means you paid out of pocket for your premium payment. So then the IRS will give you a check for that difference. But I mean, if you end up putting the correct income and nothing changes, you report the same income, then neither give or receive, and everyone breaks out even. So let's try to our best of our ability, try to put the best number. And I know, we can't avoid changes. Changes happen. You get a new job, you get a promotion, you might unfortunately lose a job. So what we can do in those cases is you can actually, anytime within the time, you can actually go into the application and report a change of income. By changing your report, the change of income, Covered California know that your income has changed, and they will adjust your premium assistance, which you will see the change in the next cycle of your premium, and it will be automatically adjusted, so you don't have to worry about that. And the other thing that they do ask is proof that you do live in California, because Covered California is for California residents, so you do want to make sure that you live in California. Now the last thing that they do ask is for your social security number, so make sure you have that at hand when you go ahead and apply for Covered California. Okay. So now let's look into the penalties. So what happens if you choose not to enroll in a healthcare plan and you do not have health insurance? So this year when you file for the 2014, it's only going to be 1%. So it's either going to be 1% of the income that you make, or 95 per adult and 45.50 per child. And it's per person. So let's say a family of 5 didn't get health insurance, you're looking into 95 times 5, or 1%, or whichever is higher. So let's say the person didn't make actually the $95 is more, they'll charge you the $95. So whichever one is higher. And then it's only going to continue to increase. Next year it's going to be 2%, and then in 2016 it will be 2.5%. And if you kind of think about it, like 1%, $95, 2%, it isn't that much. So you might think it's okay, I'll just pay the 1%. But the real problem happens when something happens to you and you have to go to the hospital. What are you going to do with humongous bills that you're not going to be able to afford? If you think it's too expensive to purchase a plan and pay a premium payment every month, what's going to happen when you get that big bill? There's a lot of people that unfortunately lost their homes, that they have to file for bankruptcy because they had large bills that they unfortunately were not able to pay. So let's try to avoid that, and 1% might be easy to pay. Let's look towards the future and realize that we're insuring our bodies. So we insure our cars, we insure our houses. Why do we insure our bodies? Can I get another liver? Can I get another kidney just like that? So let's protect every part of our body. And go ahead and rest it. So for Medi-Cal, you can apply whenever. It's all year long. In the spring, summer, winter, whenever the situation, you can apply. Open enrollment all year long. Now for Covered California, it is a little different. As you get, Covered California is November 15th, so next month, to February 15th. Now we're also, sorry, that was the Covered California. So next we're going to talk about, like I mentioned, to get Medi-Cal or to get Covered California, you either have to be a resident of the U.S. or a citizen. So what about all the uninsured people? Because I mean, if someone, the undocumented, let's say someone undocumented and they get hit by a car too, right? Just like we get hit by a car, they can get hit by a car. Let's say they get hit by a car, they go to the emergency room, they get seen. We can refuse services. Someone's telling you we're going to help them. And unfortunately, we need to be able to find plans or some way because we don't want, the prices of all the hospitals going bankrupt, doctors, and all this going on because of the medical attention that we give them. So, there's this other program called My Health LA. So this program is specifically for anyone that's not able to purchase health insurance because they're not documented or because they don't get offered their work. And there's two different programs in which they can be enrolled. One is restricted medical. So this is only if they go to the emergency room. The other program that we do have is called My Health LA. This program it helps them with primary care. So it helps them see the doctor with headers or throw her to get a physical to that their diabetes or situation is. It has the same income cutoff as for regular medical, and it's only a program. So it's not regular insurance, it's just a program for the that is available. And people that are undocumented are not subjected to individual mandates because they don't file taxes, so there's no way for the government to know whether they have health insurance or not. A little bit more information about the program. You do have to be a resident of the LA County. You have to be between the ages of 6 and older. Like I mentioned, the income have to be between under or at 130% of the federal covering line. And they also have to be black or are not eligible for any other type of health insurance. And that program does cover primary and preventative health care, covers medications, covers DHS, specialist care, emergency and urgent care, as well as any DHS facilities only. So they can only go to those facilities. Okay. And just a little information. So whenever you go towards someone that can help with the application or anything like that, make sure that you do it for free. You do not have to pay anyone that helps you or assists you, whether they're agents or certified enrollment counselors like myself. They're not allowed to charge you any money. They're not allowed either to collect any premium payments. So just be careful if you go to someone for assistance. Just make sure at the end they're not asking you for any money. And a reminder again, open enrollment is period is from November 15 to February 15. Any questions?
So yes, so now we're going to open the floor, just casually raise your hand and ask questions, and we'll open the floor for questions until 7 p.m. And please help yourself to food.
Can I get this? Can I turn it?
No, I need to keep it on the screen.
Question, can I get them on the presentation?
Absolutely, yes.
Okay. So
Absolutely.
another thing that there's a lot of mixed families, meaning that there's for children it's up to 150% of the federally covered line, which means that in a family the children could qualify for Medi-Cal and the parents would qualify for Covered California with premium assistance. So it's a little different. And once you do the application at the end, it does let you know individually per person in the application who qualify for Medi-Cal and who qualify for Covered California. And also here, there's a lot of families that are mixed, where one person could be undocumented and the other person is documented. These have to be put in the application if the part of the household. Okay. Yeah.
I'm sorry, before you start, can you reiterate his question for the people watching from home? Thank you so much. Sorry, sir.
No problem.
Thank you.
My kid receives disability SSI, and on my tax return to IRS doesn't consider that as an income. This is 2 years in a row, but the Medi-Cal takes it as an income. So we are kind of confused over who's the boss.
Okay, that's a good question. So this question was that this child's disability received SSI. He wants to know whether you would count that on the Covered California application, correct? That's your question? Okay. So does it get supplemental Social Security?
Yeah,
Is it
it says
considered?
finite.
Yes.
Yeah, it says
Okay.
Social Security disability.
So that one is not counted.
Yes.
Yeah, you did not count. Now, regular Social Security that you receive once you retire and you're not working, that you do have to report on Covered California.
But Medi-Cal forced me to report.
Oh yeah, see, there's a lot of changes that happen with the expansion of Medi-Cal, and a lot of the social workers are unfortunately not up to date. And they're doing a lot of things and denying people coverage
They
when they
actually
shouldn't.
forced me to pay some money back to them. So where should I do my,
Well, after the presentation, I do have a number which you can call. We have advocates that can speak on your behalf. They'll be more than happy to help you with that, but they should not be coming to you. Any other questions?
So if you go ahead and roll, and then at some point or another, your income goes down. Because of the rating for it. Then you have to go back to the website and you have to report a change in income, right? You have to be covered by the website. And then, eventually you'll probably give you a choose a new plan. Correct? And so then you could possibly go, let's say you get a silver program, then if you made more, you might only qualify to the bonds, to get the regular pay. If you can change that,
Okay, so the gentleman's question is if there is a change of income and income happens to increase and he reports it on the application, he gets to choose the plan again, first the eligibility part at the end, and you wanted, you can choose a different plan, correct? Yes. Okay, so you could choose a different plan.
okay, now if you already have, once you approve, and you choose also a healthcare, insurance company, correct? And what happens if, for some reason, because I know that someone who just was notified that their health plan is, and they're using their health plan. And they were told that they're not going to provide that certain program, so they have to change. They can just change that at any time they have to wait till the moment, right?
Yeah, no, so that's a,
Go ahead.
that's an event that occurred, yeah. And also during, I know open enrollment is only 6 months, but there are other events that can happen within that time frame that you can, it allows you to go into the market and purchase another plan. Yeah, and change of income, because sometimes you change the income and it doesn't make a drastic change in your application, so they keep you within the same. But if there is a change, if it's a big change, they will have you at the end, we select another plan.
Okay, so yeah, so the insurance company that you're using, stops that program.
Yeah, you can choose another one.
It's something that to event that you can.
Yes, yeah. Yeah, of course.
mine is people start finance first. So our income every month changes.
Mhm.
Shall we report that or shall we just get the W-2 for the last one?
So that's a good question because a lot of people either have their own business or work on their own as independent contractors. And then, no, but other people may have their income changes as well. So he was asking about what happens when your income fluctuates. How can you put an accurate income into the application, right? That's your question. Okay, so I could say if you feel like within the years it's been pretty much the same, I would advise to use your same ones as last year. And maybe midway or like in 6 months or 8 months, you can kind of look at it and check if what you reported is going to reflect that. If you feel that, you know, business picked up or she got more hours, whatever the situation is, I would say report it then. Don't wait until you file your taxes because then they will see that there's a big difference. So I would say report based on last year's and then just keep an eye on it. And then about halfway through the year, look at it again. And if you think it's going to stay the same, it's going to reflect what you reported, just keep it, don't worry about it. File your taxes like always. But if you feel like it's changing, whether it's going up or down, report it there and then.
This is online.
Yes, and it's all online. So when you do Cover California, you are prompted to create a username and a password for you, for one per household. And you keep that. And anytime there's a change in your household or that you need to change your application, you log in and it'll show you when you enrolled into a healthcare plan, and you can put report change on the top. You put report change, and you can actually go into the income, change the income, and you'll sign the application again at the end. And if you need to choose a different healthcare plan because you receive less subsidy assistance or you no longer qualify for that plan, you can choose it there. Or you'll be getting a letter letting you know, hey, we realize you reported a change of income. They will notify you. You no longer qualify for subsidy assistance. You have to go in there and change your plan or whatever situation.
And you can use right away, right?
Yep, you can do it right away. At the end of the tell you. Yeah.
Any other questions? Okay, great. Well, that concludes this part, and let me just stop this.